a case of incomplete abortion. In this case, patient gives history of DNE 2 weeks back, and she has been still having heavy bleeding PV. So she came to me for the pelvic scan, and here you can see that endometrial cavity is showing multiple irregular echogenic foci, and these foci are due to incomplete abortion, and these are the RPOCs. You can see irregular multiple echogenic foci. So here I want to discuss with you that what could be the other possibility and what are the other things that can mimic RPOCs. In case of RPOCs, you can see irregular echogenic foci, and there will be mild to moderate vascularity. And first of all, history is very important because there will be her pregnancy test positive, and her previous reports also support the diagnosis. Number two, there is a possibility of blood clots in case if patient is having heavy bleeding PV. So there is a possibility of presence of blood clots. But in this case, there will be no vascularity, just because these are the dead tissues. So the third one is the endometrial polyp. In case of endometrial polyp, as you know, if I draw the endometrium here, in case of endometrial polyp, you can see a smooth echogenic focus in endometrium, and there is always a stalk. There is a stalk of this polyp, and this stalk always shows vascularity. And it's quite obvious if it's a case of endometrial polyp. So in other possibilities, there is a possibility of molar pregnancy. In case of molar pregnancy, you can see somewhat this picture. There is a bunch of tiny spaces, tiny cystic areas in endometrial cavity, and history also supports it because there should be her pregnancy test positive, and there should be history of amenorrhea. Another possibility is endometritis. In case of endometritis, endometrium is thickened, and it shows high vascularity. So it's quite obvious. And another possibility is submucosal fibroid. In case of submucosal fibroid, if suppose this is the endometrium, and here you can see a hypoechoic area which is touching the endometrium. So it shows peripheral vascularity, and there won't be any central vascularity at all. So these are some differential diagnosis, and we should differentiate RPOCs with these things, and it's easy to diagnose. And here in this case, it's a very clear case of incomplete abortion because patient's history is very strong and it suggests incomplete abortion and presence of RPOCs.